Hey there, welcome to the Mental Perk podcast. I'm Carla Hutcherson, licensed professional counselor.
And I'm Brandy Mock, entrepreneur, author, and community leader. And we're here to talk about
real people, real issues, and real talk.
All right, today on Mental Perk, we want to welcome Jackie Woodfin, a passionate birth doula and wellness advocate. Jackie empowers women through every stage of pregnancy, helping them feel heard, respected, and confident, a hormone health supporter, and a mother of 5.
Wow, 5 kiddos. I thought my life was full with 2.
Yeah.
I admire women who can do that because I
know.
just always thought, oh my gosh, my schedule's crazy full. What do
Yeah.
you do with that?
You just do it, right?
I know.
My grandmother had 17.
Well, wait, what?
I know. And she always said,
When was the woman
"You
not
have one?"
pregnant? I was thinking 5 bath times,
17.
5, when you have them activities, how do you be in 5 places?
That is the hard.
Did you
that
color
was the very
code 'em?
hard.
You call it what?
Color code them.
But that is the hard thing, is like navigating through all the sports, but it's just a divide and conquer
So you got to
system a
think,
lot
if
of
she had
times.
one and 17 kids, that means 17-year-old all the way down to maybe a 1-year-old.
17 and 23 years. So the thing that fascinates me is that for 23 years, she was either having babies, pregnant, or breastfeeding or something. For
Oh my
23
gosh.
years. Yeah.
I can't even imagine. I am definitely not woman enough for that.
Break between mine. Ooh, yeah. So talk to us. Tell us what got you into being a doula.
Well, I've always loved birth work.
Okay.
I've always been fascinated with the whole birth experience, of course, my own, but even prior to that, even when I was a young girl, just fascinated with birth and the process of birth. But I actually supported one of my very best friends from high school as she was a single mom having a baby. And looking back now, we can connect the dots backwards, but at the time I was like, I was her doula. Like, I helped support her through the whole birth process. I was just her support. And I always thought, well, I will probably be like a labor and delivery nurse, maybe an OB, but probably not. That's a little too much school for me. And then I started having my own kids. And life is just busy and crazy.
Yeah.
And we homeschooled for many years. And it just kind of I didn't really think about it much more after that, and just thought, I'm not going to go to school. I'm not going to pursue this right now. I just want to be wife and mom. And then I got involved in the homeschool community. And that's when I learned more about doulas and what a doula was, because I never even knew what a doula was, growing up or even into my 20s and 30s. And then I learned and experienced what a doula was. And I was like, now that I could do. Because it's non-medical. Doulas are non-medical. We are supportive. We give mamas emotional, physical, informational support through pregnancy, labor, delivery, and postpartum. But we are non-medical. So there's no medical school. There's no anything like that. So I did do a certification process that you go through. There are lots of nationally recognized certifying organizations, and I chose one here in the Dallas-Fort Worth area, actually, Birth Boot Camp. So I decided to be certified to do that. And then I just ran with it and just began serving these mamas and helping them. One of the main reasons is, did you know almost 45% of first-time moms say they've experienced birth trauma? And it was important to me to help mitigate that or help lessen that. And I even experienced birth trauma in some of my births. That wasn't as traumatic as some women might, come away from, but it's things like not being in control, having things done to and for you that you didn't give permission for, and not being brave enough or not even knowing that you could say no or yes or I want this or don't do that. It's just things that were done to you. And that's one of the number one reasons that moms say they experience birth trauma, was being out of control.
So explain some of those, because that's very interesting, because one, what you just said, a lot of people don't realize they do have control, right? So give us a few examples of what they felt like they didn't have control over.
Yeah. So like being in a doctor's office and you're being checked or examined and things being done to you that you didn't get permission to, like if you were having a cervical check and the doctor says, I'm just going to go ahead and help you out here, and does a cervical sweep that really, I don't know if you know what that is, like releases the membranes from the cervix that can kind of help women go into labor.
Okay.
And a lot of things are done without their consent.
Wow.
Yeah, and it can be as big as of something like that, or just things in actual birth, having your placenta released without, through tension, without you giving consent to that. If you want your body to naturally release the placenta, but maybe the provider takes it upon themselves to manually release the placenta, and you don't want that, or having things on your birth plan that you don't want that are done. If you want delayed cord clamping, and they don't honor that, and they cut the cord.
I don't even know
I'm
what
like,
any of this
everything
is.
she just said, I'm like, I had control over that and didn't even know it.
That's primarily what the
Wow.
response that I hear from so many women is, I had no idea that I could say no to that. I had no idea, because a lot of times we're told it's hospital policy. Oh, it's hospital policy. We have to do this, or it's the verbiage, the way it's presented to the women. Like, okay, we're going to go ahead and cut the cord now, or we're going to go ahead and do an episiotomy, or, things like that you don't want, or that even if you do want it, you should have been given the opportunity to say yes or no to.
Just educate me on even what it is, right?
And
100%.
the second thing, women say is lack of communication. The reason they felt trauma, feel like they were traumatized through their birth, was lack of communication. And so sometimes it's just not knowing, like maybe they did give consent, but they didn't know what they were consenting for. Maybe they did say yes, okay, but it wasn't communicated clearly enough for them to give informed consent.
Or maybe they didn't know what the choice was. Like when you say clamp the cord, you know that that's kind of a normal process.
Right.
So you don't know that there's a timing there that you can choose.
That's exactly right.
Which I didn't know either. I mean,
Yeah. Or if say a provider comes in and says, baby is at a -2 station, so we're going to start Pitocin at 2 by 2. And you're just like, okay, because you're the provider, whatever that means.
Yeah.
Okay, they just consent to it. Whereas they might not would consent to something like that if they knew exactly what that meant.
Yeah.
And so, or even if they would have consented to it, they should be given the opportunity and be given the information of the risks and the benefits, because there's always both to anything, a decision made in the birth world. And they should be given that opportunity to have true informed consent, not just, okay, like kind of deer in the headlights, you said so.
Yeah, because I know I was given Pitocin with my second child, and you're right. It's a night and day when you go through natural labor versus someone inducing you, because I was high risk. So inducing you, you don't know how hard the contractions are. So much harder to me. They were for me,
For sure.
when you're given that, and it just made it a whole different experience.
For sure.
Even though I did do the epidural, right? That went wrong. They had to hit me 5 times in the spine, and then I couldn't feel my legs for 2 days. So, a lot of those things you don't know, though, because you're just you're focused on just giving birth.
Yep.
A healthy, safe child for mom and child, right? But yeah, that Pitocin really it cranks it up a whole lot more.
Definitely.
And it doesn't get explained to you like that exactly every time, like you said. So that's very interesting.
I think a misconception for a lot of women is that, so what gets labor started is the release of oxytocin in our bodies. That's a hormone that is released that initiates labor and gets that going. Well, a lot of times Pitocin is portrayed as, it's just oxytocin. I think a lot of women think induction with Pitocin is just like natural labor. It's just like the release of oxytocin. But the difference is, when your body naturally releases oxytocin and goes into labor naturally, it also naturally begins to produce natural pain management as well. So other hormones that can help you control the pain. But when you have Pitocin, which is an artificial way to get labor going, your body doesn't recognize that. It's not the same.
Or it's not keeping up to that
not.
speed.
And your body also, it's a beautiful thing that how God made us, is that you have the contractions, but your body also knows how to regulate that. Like it gives you a break. Like when mamas who are laboring naturally, they have the contraction pattern, but then sometimes they'll slow down a little bit. It gives their body a break. But when you have that Pitocin, it's just slam, slam, slam. Your body doesn't have a chance to say, whoa, so it can be a lot more painful for sure, and intense. And what happens a lot of times is you start with one intervention, like Pitocin, and it causes what we call a cascade of interventions, because you may not have wanted Pitocin, but then you go in and the doctor's like, oh, baby's too high. We need to get things going here. We need to give you Pitocin. And so you start Pitocin, and then, whoa, it's way more than you thought it was going to be. And you didn't want an epidural, but all of a sudden you're like,
you need one.
Give you that epidural. So then you have an epidural, which can cause, not always, some people have beautiful experiences with it, but it can cause other issues with moms not responding well or babies not responding well, which can oftentimes, one thing leads to another in a C-section or trauma, birth trauma.
Yeah, I mean, that was the only time I cried, was when they were doing the epidural, because it was so and you could hear it. You could hear that needle. And, of course, my labor coach was my cousin. She was a nurse, and she's looking at the anesthesiologist going, what is going on?
Yeah.
Like, why are we not getting this? And then not being able to walk or feel your body. It was pretty traumatic. But now I'm starting to see a shift. Back in the day we talked about, there wasn't a choice. You had natural birth. There was not these interventions, Pitocin or epidurals or anything like that. But I'm starting to see a shift, which is so neat to me, where people are doing at-home births. They've got doulas. They're doing all these things that are more natural for their body, the way God intended it, I really think, right?
For thousands and thousands of years we've had natural births.
Right, and it kind of makes me wonder, like, I know back then, giving birth, there wasn't all the medical expertise to be able to help with cyst if something went wrong during a birth, but it seems like you're seeing
that now.
I know, and that with people like you, we're seeing a lot more of that. So are you starting to see a shift?
For sure.
And
I think
people
the pendulum is kind of swinging to the other way. Turn of the century, mid-century, we had a lot of hospital births. It was uncommon for women to birth out of the hospital, even though for thousands of years leading up to that, that's how we did it. But turn of the century, mid-century, a lot of medicalized. Even back then, they would just totally knock women out and, give them drugs to help them forget what happened and just take the baby.
I was thinking of like my husband's grandmother. She went and had the baby in the morning. She was feeding the cows that night. I mean, just that's what farmers did. That's how they did it.
I think that's how the women did it back then,
that's
right?
It's very interesting.
Created. I don't necessarily recommend that in postpartum, but I do know that our bodies are created to do this. And of course, there are peripheral, there are anomalies, there are things that do happen, and thank God we have medical interventions for that. But I do believe that a woman can and at least should be given the opportunity to birth how she wants to birth. And honestly, as a doula, it doesn't matter to me how a woman wants to birth. I'm there to support her in whatever that looks like for her, whatever.
So they could be in home or in the hospital.
Yes, like probably 80% of the mamas I serve are hospital births. And then the next would be home births would be the most, and then birth center births. But I am seeing more home births and more birth. I am seeing this pendulum kind of swing. And even if they don't choose a home birth, a lot of women are choosing natural physiological births in the hospital even. And before it was very hard to have that. Sometimes it still is because providers tend to want to induce early. There's a huge, a lot of providers have a huge induction rate and want to induce for non-medical reasons.
It's more about like scheduling, making
That's
sure,
right.
yes.
Convenience.
Yeah.
For them, not for the mom.
Sometimes it is for the mom.
Or maybe
it
the
social
hospital's full
induction.
or things of that nature.
Social
So there's
induction.
Social inductions, elective inductions. There's no medical reason to do it, but, things as, I won't say trivial, but kind of trivial as I want a certain birth date for my baby.
I've heard that before.
Yeah.
I have too, actually.
Some of the things you've said have just answered one of my questions because I was thinking about this and, we talked about this whole process, but if you're in home and you're not medical and we have a medical issue, what are the steps to that? But you said a lot of yours are already in the hospital, so you're able to get the medical attention on those emergency situations.
Yes.
I mean, both of my babies were both emergency situations. One was during the labor process. The other one was after. So she was born with the issue and needed, to be in the neonatal unit really quickly.
Right.
So those kind of things, I think, how do you manage that? Or do y'all have a process if you're not in the hospital, what that looks like?
Yes, so out-of-hospital births are attended by midwives, and they are trained and skilled just like the OBs are. The only thing they can't do or C-section. So they're not going to be doing any surgical, but any medical interventions that they need to resuscitate and most births are done pretty close to hospitals. A lot of moms who birth out of hospital either will do it at their home and it's closer to the hospital, or they'll do it at a birth center that is located close to a hospital too. And so, but rarely are there issues in birth that need a emergent right then care. Like it's immediate right then. But if so, they're skilled and trained and have all the things to help with hemorrhage and, if they need oxygen, any kind of resuscitation, things like that. And then also can transfer to the hospital, which can be done
pretty
very
quickly
too.
Yeah.
So, but I don't think a lot of people realize how skilled and trained midwives are, and that they have all the tools. If you could just go and sit with a midwife and interview a midwife and see how skilled and trained they are for emergent situations like that. I think a lot of people think they're just hands in the air, like, well, we don't know what to do with this, and that is not the case. They are skilled like an OB, but they are not surgeons. And even in hospital, midwives don't perform surgeries.
Right.
If a C-section needs to be done, it's done by an OB, not by a midwife. And so out of hospital is just the same. And if it was something that needed emergent care, it's transferred, immediately transferred. But it's rare. I mean, I've had some home births where we transferred to the hospital, but they're not emergent situations. It's typically mom is exhausted. She's labored for a very long time. She does need some medical interventions, maybe an epidural just to rest for a while, but maybe more interventions than that. And we transfer, but it's rarely an emergent transfer where mom and baby's life are immediately in danger. Can that happen? Yes. Does that happen? Yes. But it also happens in the hospital.
Yes.
And there's a much higher rate in the hospital of emergencies and things happening to moms and babies than out of hospital births.
That's interesting, isn't it?
Yeah.
I guess because it's not as popular, I guess, doing the home yet. But I've got nieces that have had 5 of their kids at home, and I'm like,
well, and midwives won't take high risk mamas in pregnancies.
Okay.
And those are done in the hospital. So OBs, in their defense, they also have a higher number of women who are high risk.
Right.
So of course they're going to have higher instances of things happening in the hospital. So midwives won't take high risk moms.
Do you find the hospitals are treating you,
I was wondering that.
with respect and really, respect the role you play when you're assisting someone within the hospital?
Well, some do. It's very interesting. It's very interesting because my role as a doula is never to come in and counter or give opposition to any provider that a woman has. I really am just there to support the woman. So I will never stand up against a provider and speak out against a provider or make where they wouldn't want me to be there. One way, what it looks like for me with a client is to help her advocate for what she wants, to help her have a voice and advocate for that. So I encourage the mama to be the one that speaks up and speaks out. There has been a rub. There can be a rub between hospital providers and doulas who are there because I think they're not quite used to having mamas speak up for themselves. And it's a whole lot, it makes their whole job a whole lot easier if moms are just compliant and don't ever question anything or just say whatever you want. I had a mama tell me that her OB, she was questioning some things that he wanted to do or have done, and she was questioning that, and he said, "You hired me for a reason, just let me do my job." And that's a red flag right there. We, as women, as pregnant women, we should have the right to question everything. We should have the right to say, why would we do that? What's the risk? What's the benefit of doing that? What's another option if I choose not to do that? And then be respected in what that choice is. Because, even as a doula, I have clients that make choices that I wouldn't choose. They choose to do things that I wouldn't do, but I respect the fact that God didn't give me their baby to make these decisions for. He gave them that child. My role is to give them all the information they need to make an informed decision and then respect that. And so I think that doesn't come a lot of times from some providers who have what we call a God complex, and they just want it done their way, and because they think it's the best way. And in their defense a little, they see the worst of the worst, and they don't want to see the worst of the worst anymore. So they kind of tend to treat women with what we call standard of care. Everybody gets this. This is just what we do. This is hospital policy. Everybody gets an IV. Everybody, a lot of women don't know that you don't have to get an IV. You have the choice. You can refuse everything. But it's important to know the risks and the benefits of what you're saying yes to and what you're saying no to. And sometimes it's skewed, or it's handled in more of a fear-mongering way. It sounds a lot more traumatic if you say, well, the risk of going past 39 weeks doubles your chance for stillborn. That's very hard for a mama to hear, and you don't want that for your child. But if you said, well, your risk goes from 0.2 to 0.3% chance of that happening, that's a lot different, right?
Yes.
But if it does, or from 0.2 to 0.4, there's a big difference in saying, your risk for stillbirth doubles if you don't induce by 39 weeks.
So it's not like 20 or 40%. It's like,
exactly. It's a very, very small percentage. And yes, it might double, but what is that percentage?
Yeah, but for a first-time mama or a young mama, you even just saying that, and I'm a mama too, kind of scares you.
And they'll go, okay, induce.
Yeah, I would. I'd be like, look, we don't want to have any issues.
Yeah.
But the fact that everybody needs a Jackie before they give birth. No, I'm serious, because there's so many things. I mean, we're all sitting here mothers.
Yeah.
And I never even thought about all the rights. We all know we have rights.
Yes.
There's this intimidation factor, I think, when you see a doctor. And you just kind of think, well, they already know what they're talking about. We're just going to go with it. But then just the small, minute things like knowing, hey, if you don't want an IV, you don't have to have an IV.
Yep.
And here's the deal. That's fine if you don't want one, but educate the mothers and the family members that are in there supporting mom. These are the risk factors that take place if it doesn't happen, or, ABC, instead of just doing, we're going to do it the way I say do it. Because there's a lot of things that I think a lot of mothers-to-be would be changing, which is why we're letting her talk about it, right?
Well, yeah, and I love the fact that we're giving back that sense of control, because birth can feel out of control.
Yeah.
It can feel like I have no idea what's happening to my body, right? So I think it's really good to say, you know what, there are things in this process I have control over, which makes the mother a lot more confident.
Yes. And birth is so unpredictable, but, when you have those instances and the things come up that you should have control over, say over what is done to your body and the decisions being made, that can be very empowering for a mom, and they should have that. It can decrease birth trauma, because like I said, the number one reasons moms say that they had experienced birth trauma was feeling out of control. The second was lack of communication, and then the third was not having that practical and emotional support, where they just felt so alone. And so, having a doula in your birth space can help eliminate that, because even in the hospital, we have some amazing labor and delivery nurses. I'm not going to rag on, I'm telling you, incredible OBs, incredible labor and delivery nurses. But in the grand scheme of things, even your nurse is not with you 100% of the time.
Right.
They're there a very short amount of time, comparatively speaking, to the amount of time you spend in the hospital. And even if you're their only patient, they're still having to chart and, do other things that their job entails for that shift. And then a lot of times birth goes very long, and we go through multiple shifts of nurses. So you have multiple nurses coming in and out and changing, and your OB, your provider, is really there a very short amount of time.
And birth is such a vulnerable process, right? So then when you have multiple shift changes, you have to redevelop those relationships. And when you have the doula, you have this one person who's constant in there and allows you to get through very vulnerable positions, right? So I'm just saying.
Yes, all the things. And to have someone that's even just sitting there with you, helping you cope through all the changes and everything 100% of the time. So, and we've established a relationship through pregnancy. So it's not just, I came on shift when you were in labor, we have established through pregnancy this relationship, meeting together, sharing, helping them, informing them throughout their pregnancy. So when labor is onset and we know each other very well, whereas they don't get to have that with a nurse and even their provider, even though they've seen their provider throughout their pregnancy. You know what those appointments look like.
Yeah.
They're very quick. Yeah.
They're
It's
very
a cattle
quick.
call.
Yeah.
Yeah.
So to have someone that supports you through your entire process, that can answer questions about what is that? What did that mean? What do they mean? They're turning the Pitocin up 2 by 2. What does that mean?
Yeah.
To be able to help answer those questions for these women who are already scared, already going through all
These
Massive
changes.
changes.
a lot of changes. So to have someone there that stays 100% of the time with you can be very empowering for a woman, because that's the third thing that they say is that to feel not supported. And so to have that can help a mom, can lessen the trauma from birth.
No, did you have a question?
Well, I was thinking, you're walking these mamas through this, which, man, I wish I would have had a doula.
It would have been nice, yeah. It would have been nice.
How much guidance are you giving fathers or
Yes.
the spouses to be?
Yes, so that's a
Anytime.
cool part too.
Yeah.
Is I always tell the dads. So the dad knows mom better
Right.
than I will ever know her,
Right.
and I know birth better than he will ever know birth. So together we're just a dream team for her, because we get to. It's all about her. But if I can help him help her, it's a win-win.
Yeah.
It
Yes.
helps her. And to make him feel comfortable and to empower him to help her.
Yes.
And I have some dads that will say, I don't want to do any of that.
I'm sitting in the
I'm
corner.
I'm going to sit right here.
I'll name the baby.
I'm going to hold her hand and tell her she's beautiful. But I don't want to do that. And then on the other end, I have some dads that are like, I'm going to do it all. I just
love
don't know
it.
what to do. You tell me what, when, how
Yes.
to do it.
They want to be very
They
involved.
want to be very
I love
involved.
that.
So I'm really there to fill in all those gaps. Maybe I'm doing it all and just helping him get coffee or something. Or maybe I'm truly helping him position her and love on her and show her the support through comfort measures and, verbal support and all the things that he can be the best support for her.
Yeah.
But usually it's in the middle. Usually I'm doing more in the middle. There's rarely a dad that I'm just lead guiding and directing, and rarely a dad that's just asleep on the couch. Wake me when the baby's here. It's usually in the middle, and we work as this well-oiled machine together to help her have the most beautiful birth we can.
But again, you've built that relationship with him along
That's
through the
right.
pregnancy, so he trusts you in that
That's exactly
situation.
right. He's not always at all of the appointments. Sometimes they are, but in one of the prenatals, it's specifically designed to go over all of the comfort measures that we're going to use. I bring my tool bag, all of the tools that we use in labor. So the first time they're experiencing that is not when they're in labor, but then I also let dad use the tools too and see and help him know how he can even help her in early labor before I'm even there.
I
When
love
she's
that.
experiencing contractions, but it's not quite time for me to be there with her yet, he can help her. So yeah, we formed this relationship through pregnancy. So in labor, we feel like family.
So you're like on call then. You're on call. If a lady goes into labor at 2 a.m. in the morning, Jackie's coming.
Yes, and that's another reason why I waited so long to start as a doula. I'm finishing up my 5th year as a doula, but I waited till my kids were older, because that's a hard thing. There are doulas who do it. They have little kids and they are able to do it, but they have to have a lot of family support.
Yeah.
Because from 38 weeks to 42 weeks, I'm on call 24/7 for my clients. And when you get called out at 2 a.m, you may not be home for 2 days.
Wow.
Like labors can go very long.
Yes.
And so you have to have someone that can take care of your children and run the household and
Yeah.
things like that. I'm lucky, my children are older, and so I'm able to do this now and not worry about that, but that is a concern. So
But you also have a husband too that supports it
Yeah,
too. Which
100%.
even if your children were grown, you've
Yep.
got to have the husband on board.
Yep.
And you're lucky to have one that's supporting you in everything you do.
100%.
So we talk about all this as far as like you're with the mom throughout the pregnancy. Let's talk about post pregnancy, because that is such a huge thing. I know that.
And I wanted to point out
go ahead,
too. No, that's okay. I wanted to point out that as we're thinking about mental health, because what your question is about to
Yep.
get to is postpartum. I also want to talk about that the research that I did. really gave credit to doulas because they spend so much time with women before the birth that you are able to see mental health issues before they happen, or substance use issues, and those are the two highest complications. And so it's really interesting how you actually would see that before and then into postpartum, which brings us into Brandy. And I didn't mean to cut her off, but I just wanted to kind of get you to follow the mental health process from the pre-pregnant or the prenatal stage to postpartum.
Yes, and one of our roles is to provide resources for our mamas, and we do that by recognizing if there are issues, but also just generally speaking, I try to help my mamas understand that there are resources for them if they start to experience any kind of postpartum depression. And we address that going, even through pregnancy and stuff.
Do you see those hormonal changes, though, starting to happen even prior to labor?
Oh, yeah, for sure. Through pregnancy, moms get really weepy. I mean, we've all experienced that. Even moms
you don't even know why. I don't even know. Confuse yourself.
Especially all the trimesters have different, challenges. The first trimester, moms don't feel well.
Yeah.
They're sick. They're not they feel bloated. They're not fitting in their clothes very well, and they just feel yuck. Mm-hmm. And so that can cause a lot of mental decline.
Yes.
And then we feel better in the second trimester, but this is where changes are really starting to happen, and you're not fitting in your clothes. Mm-hmm. Third trimester, you're just over it. Like, you're so ready to have this baby, and you're feeling the fluctuation of huge hormone variations and stuff, and to be able to recognize, I think a lot of women suffer needlessly.
Oh yeah, I agree.
Going through that, and so it is so good to be able to stay in communication with these mamas and start to recognize that. And especially in postpartum, I tell husbands, these are some things to look for. I'm non-medical, and I'm certainly not a therapist, but we can recognize some signs and symptoms that a lot of women, I feel like, just think, well, it's just part of having a baby.
That's it right there,
and it's not.
The interesting thing is I don't think enough education is done in the medical office for women to really understand what to look for after the birth of their baby. And, I mean, I have patients in my office who, right now I have one, in her marriage is having issues because what she was going through was postpartum, but it looked like it was marriage issues, and it wasn't.
Nope.
And so I'm just like, I feel like as a doula, you're there and you're helping train them before it happens, whereas many times doctors don't catch it till it's already in the midst of it.
And that was me. With Priscilla, my first child, I went through postpartum so bad, but I didn't know what it was, Jackie. I had no idea why I felt the way I felt. I didn't want to hold her sometimes. Thank God I had a brother that was just, he'd put her on his chest and just bounce her, because I was like, and it could be, but the way I've explained it now, my second child, I was ready for it, right? But I was probably 3 months in after having her before my doctor's like, I think you're going through postpartum. Yeah. I'm like, something's not right here. Yeah. Like, it's not right. You just, and people need to be more compassionate and understanding towards that, because the way I explain it is, you're carrying this beautiful thing in your body for 9 months, and it's growing inside you, and then one day it's just ripped out of your body. Your body's in shock, I think. It's like, what just happened? What do I do? And so I think your hormones are so out of whack, and it's like Carla said, we've heard cases, we've seen cases of where mamas have done some really traumatic things to their children, unfortunately, because, and then you go back and you're able to interview them and see what was going on, and 9 times out of 10, it was linked to postpartum. Yeah. They had no idea.
And had it been recognized sooner, it would not have gotten to the psychosis part of it. And, and that's rare, the psychosis part of it. But even way before that, women suffer needlessly through depression and feeling a lot of bad things about themselves and their children and their family that ripples into other areas of their life, like you were saying, into the marriage.
So how far do you stay with them, or how long do you stay with them following the birth that you would be able to then see some of these things? How long do you see them?
Yeah, typically about 6 weeks, but some of them 3 months. And honestly, I stay connected to some of my mamas for still, like 5 years later.
Okay.
They're still, how are y'all doing? We still check in and stuff like that. We have truly developed a friendship and a relationship through our doula client position. But typically what I do is I like to go within 72 hours of birth, or not birth, of them being home, 72 hours of them being home, And so I go into their home, I go and check on them and just see how they're doing. We kind of revisit the birth a little bit and just, I'm non-medical, so I'm not there to do any kind of exam, but just really to just love on them and see how you're doing. And what's funny is so many times I can see when they answer the door or when I lay eyes on them, either how they're doing, like emotionally and mentally. I'm like, oh, she's struggling. Or she's, oh man, she's got it. You know, it can be a very physical thing, but I've gotten to know them through our relationship.
See it on their face.
And see.
You know, a lot of times it may not even be the medical part that's leading to the depression. It could be the transition into motherhood, right?
Oh, for sure.
So because that is a hard transition, and the sleepless nights, and then having some, you know, this little being be so dependent on you. And so for some moms, that's the trauma part.
Yeah, and it's changed everything. Everything in their world has changed, and which is a good thing in a lot of ways, but also it can be very traumatizing. You know, like my body has changed, my sleep patterns have changed, my relationship with my husband has changed, my relationship with my other children has changed. It's all changed. It can all be a very positive thing, but it can also send a mama into a spiral if it's not addressed or taken care of. And so it is good to recognize that and to give resources to her to get help. Because I'm not that person for her. I can help her in the moment, but my role is to send them to people who are skilled in that and specialize in that.
You're giving them preventative tools.
Yes.
You're telling them, hey, let's not be reactive, let's be preventative.
Yes.
So if you do start to see certain things, how much do you work with these children? Let's say, you know, because I'm thinking doula, she's working with mama, she's working with daddy. Do you sit down and talk to the kids ever and say?
That not typically. It's really just between the mom and the dad. And in our postpartum visits, I do share with the dad. I'm like, here are some things to look for. Because sometimes you're too close to the forest to see the trees, you know. But to know, like, being sad and crying is not, that doesn't really concern me as much. Like moms, we have this fluctuation of hormones. And a lot of moms, we feel weepy. And we're like, I don't really know why. So a lot of times it's more of the detachment. It's more of an apathy. If you start to see a mom that seems very apathetic, kind of lack of feeling for, like, I don't care about this baby. They don't want to be hands-on. Was it you that was saying?
I was,
like,
yeah. And then you went through guilt. I felt guilty because I'm like, you're so in love with this child, but you don't understand. You know, was
What's
it
happening?
You're afraid you're going to hurt it? Was it that you're, you know, what the emotions are everywhere.
Right.
And so, and then I went through, even still now, Jackie, I feel guilty sometimes because it's like I should have been in a different place.
Yeah, that's a good point because I think a lot of women, I think we're made to feel like if your baby's alive, if you lived and your baby lived, then what's the problem? Just go on about your life and everything's good. But that's not the case. You know, healthy baby, healthy mama is not the gold standard here. Yes, of course, we want that.
It's well-adjusted mama, well-adjusted baby.
Yes, because that is truly what is a healthy mom and healthy baby, right? So that's kind of bare minimum. Yes, of course, we expect to have healthy mom, healthy baby. But there are other things on top of that matter a lot to these women because I talk to women my mom lives in a assisted care home and she's 81 and she's like one of the young ones. There's a lot older. You can talk to them about their births and they remember every detail. Decades and decades and decades later, women take their birth with them forever. We can remember. You said you still feel guilty, and this is decades later, right?
I do, yeah.
And so I feel like it is very important to help support these moms in birth so they don't have trauma that they carry with them their entire lives. It's important for their mental health.
Oh, 100%. And I feel like, you know, when we think of postpartum depression, we think of that detachment, but it also comes out as anger and irritability. It could come out in other ways of just their own body issues, or it could come out as being obsessed with the child.
For sure. I've
right?
seen that.
Yes.
Sure.
And that is a form of postpartum where they won't let anyone else deal with the child and they're just overprotective of the child. So those are some other ways.
That felt that way, that they're like, they'll even say, I know this doesn't feel right, but I don't trust anybody else with the baby.
Yes.
You know, I don't want any, like even the dad, even when he's with the baby, I feel like I have to be watching them because they're going to hurt them or something's going to happen to the baby. So that's definitely an indication of some needing some intervention of some sort.
Yes, definitely. So these are definitely things that, we want our listeners to really take in, so that if it's yourself or someone to be watching for these signs and be able to then, locate the appropriate help that they need.
For sure.
Yeah, because I think we go back to well-adjusted moms, well-adjusted babies, where everybody is making these transitions in the best way and healthiest way that they can.
Yes. And I think a lot of women who have birth trauma are carrying that with them, and then they're hearing all these voices, these outside people telling them, well, at least this didn't happen. At least your baby's healthy. At least you took your baby home. At least. And
almost
I think
it's
that's
minimizing their...
Yes, and I think it's very important for people to realize that can cause trauma to a mama, and some mental anguish for them to feel, because they are truly feeling traumatized from this event, and then for it to be minimized. So I always tell mamas who experience things like that, it's okay. You can sit in both places. You can be so thankful that you and your baby are here and healthy, and you went through that trauma situation alive. And you can also regret that it didn't go as planned, that it wasn't according to your birth plan, that you didn't want, if you wanted to have a home birth and you had to be transferred and had a hospital birth and all the things happened that you didn't want to happen. It's okay to feel disappointed in that and sad even.
Like women who have C-sections, they may feel they failed.
Absolutely.
Yeah.
And it's okay to feel like, I'm sad that happened, but they're hearing all these people saying, well, at least baby's healthy, like they shouldn't be upset and feel traumatized. And so I think it's important for society to know, that's not the way to handle it with a mom. Like it is validating to say, I understand.
That's an excellent point too, because there's a lot of people, I even think I'm guilty of it sometimes. Well, at least, you're trying to say something that's going to make the mom feel better, but you don't realize you're minimizing their feelings.
Yes.
Yeah, and I think a lot of times we focus too hard on trying to say something to make them feel better rather than just validating where they're at.
Being still.
Yeah. Just letting them process those feelings.
Yeah. And we don't always have to say something. You can even just say, I'm so sorry.
Yeah.
I'm so sorry. I know
That's got to be hard on you.
It's got to be hard on you.
Yeah.
Not, well, at least your baby didn't die.
Yeah.
That's
the difference between sympathy and empathy.
Yes.
Sympathy has the, well, at least, where empathy has the actual tie into the emotion.
Yeah. So I think I would tell others, before you start to say, well, at least, let's just don't say anything.
Yeah.
Yeah.
That's a cue to say, let me rethink this statement. So I think that's really important. And we've been talking a lot about, prenatal and pregnancy and labor. Another thing that I'm just really interested in, because I feel like as women, we need to know more about this hormone support.
Yes.
Please tell us what you know about that. And it's just so important. I feel like women,
we're both going through it.
Yes. And I'm
Big
just thinking,
time.
women don't really understand the importance of hormones in their life.
Yeah.
And so I think it just does a number on us.
It is becoming more popular, though, now that we, to address it. I see it more. For me personally, it was a very eye-opening thing to, be a healthy woman most of your life, and then all of a sudden things start happening, and to try to figure out what it is. I think hormone health, number one, is kind of like trying to hit a moving target. It feels like it changes all the time, but I think it's imperative to find a good provider that will do the appropriate testing and not minimize what you're going through. And not, I think a lot of times tests are run, and if your levels show normal, then you're dismissed.
Yes,
it's like
100%.
Everything shows normal, but that normal doesn't mean optimal. And if you are experiencing symptoms that maybe show normal on blood tests, you have to have a good provider that recognizes both, that looks at both, that looks at your blood work, because that is important, but also acknowledges your symptoms and tries to, reconcile those together to find the correct treatment for you, because we do rock along in the prime of our lives with optimal hormones, typically, most women. And as we get older through perimenopause and menopause, those hormone levels can decline. And I think it's important I'm all for hormone replacement therapy. I know that's a very controversial topic.
It is very
and stuff,
controversial.
And I'm not a professional on it, but what I can speak on is just my own experience. And a lot of it started, I feel like, with when I had breast implants. We talked about.
Yeah, I'm interested in this, yeah.
Yeah, so in 2010, I had breast augmentation, and I can't pinpoint a specific date and say on this date I started experiencing issues. It's not like that. It truly is a slow fade. Looking back, we can connect the dots backwards now and say, oh, that's when it happened. But, when you're going through it, you don't recognize it. So probably within a couple of years of having, or less maybe even, of having them, I started experiencing a lot of symptoms that I feel like were contributing to my hormone decline.
Okay.
And the thing with breast implant illness is it's not an official diagnosis, really. I mean, I think they're just now applying it to things, but there are so many symptoms from breast implant illness that can be attributed to other things that it's very hard to say implants cause that. So without having a specific way to diagnose that, all I have to go on is my body, my reaction to them, and what happened when I had them removed. And so I rocked alone for many years with lots of things declining in my body that started with hair loss. I've always had very long, thick hair my whole life, and just it was coming out in handfuls and breaking off, and it didn't even look anything like what my hair had looked like. And, there's a school of people who will say, well, that's getting older, Jackie. You're getting older. But when like
it's just not right. Yeah.
Something is not right.
Yes.
And then I had like hormones checked, and they were like, everything looks normal. See ya. And I'm like, no, it doesn't. Something is not right. And then I started having some autoimmune issues, some skin autoimmune issues that I'd never had in my life. I felt like there were one thing after another, so many things happening to my body that didn't feel right, that I knew was wrong, and couldn't find someone to help me. And then I ran across a group that was specializing in breast implant illness. And I was like, 500,000 women, like thousands and thousands of women having the same symptoms and more. There's tons of symptoms for breast implant illness. And it just got my attention. I was like, oh my gosh.
I need to learn more about this.
I do. And I just started diving a little deeper into it, and, just realizing that and feeling within myself that my implants were what was causing this issue with me. And so I made the decision to have them out. So I had them for 10 years. And so I struggled with a lot of issues for 10 years. And what I can say is that, no, you can't, there's no one person or a doctor that can run a test. There's not a test you can run that says you have breast implant illness. It's all pretty much anecdotal. For me, though, when I had my implants removed, there was almost immediate relief of many of the symptoms that I'd had. And I'm talking about from the next day to 3 months out, and now I'm almost 5 years out, and I don't have one single symptom that I had when I had my breast implant.
Okay, it's so interesting. And I was just thinking about this, when people have an organ transplant, they have to go through all this anti-rejection routine because you have this foreign object in your body. It's got to be the same with an implant. Some people are going to react in a way that their body rejects it.
That's right. It's just like some people are allergic to other things, and I'm not saying it's necessarily an allergy, but your body, when you implant a foreign object, the natural reaction is for your body to do something to
It's like a splinter. You get a splinter, your body naturally pushes that splinter out.
Yeah.
And most implants that are removed have capsules around them, which was they didn't go in with the implants. This is what your body produced around the implant as a form of protecting itself from this implant. And so my theory, and I'm not a scientist, and I don't have anything to back that up as far as actual statistics and studies that have been shown, but what I feel like with my body was fighting for 10 years against these implants. And so that's exhausting and tiring for your body to have to work against. And then the other things start to fail. The thyroid starts to fail. The autoimmune, the skin issues, because your body is like, I'm fighting very hard against this. I just can't spend as much energy on this,
Yes.
And so those other things started to fail. And then when I had them removed, gone.
Wow.
So my thyroid issue, because I had, my thyroid was underactive, and I was at like a really high dose, and they've reduced it almost down to it's the very bare minimum, and that is almost unheard of. Like typically, if you have a thyroid issue,
you're on it forever,
and it typically increases, and so mine has gone the
other way,
opposite.
Yeah.
I immediately lost weight. That was one of the things, unexplained weight gain. I've been in health and fitness my entire adult life. I've watched what I eat. I work out. I've always taken very good care of myself. So it was very frustrating to see this weight gain go up. And people will say, well, it's your thyroid. Your thyroid's off. Yeah, probably. Yes, it was off.
But what caused it to be off,
caused
right?
that to be off, right?
Yeah.
And then when I had my implants removed, I immediately lost 13 pounds within like 6 weeks.
Gotta have mine taken
crazy.
out, y'all.
I'm telling you. And I
No,
didn't
but you
change
talked
anything
about
else.
skin issues.
Yes.
I itch severely and
Yes.
bruise really bad. And of course, you have all your levels tested. And I have a niece that just had hers removed. Same thing. She said, Aunt B, my body's off.
Yeah.
Like my body's off. I don't feel right. And now she feels better. So I think
There is something to
there
it.
is something to
I
it.
think
And
so.
the way she explained it was just like your body. It's not supposed to have things put in it. It's supposed to have it taken
and
out.
it's working so hard all those years
Yeah.
to fight against it, and it just starts failing in other ways. I just don't think that you can have as many women with these symptoms,
Yes.
from breast implants, and then they have them removed and the symptoms go away. There is absolutely something to that. And I did read a study in the NIH did, and on women who had implants, 22%, they had 22% more autoimmune issues than
Wow.
not.
For some reason, that
That's-
doesn't surprise me.
But no one's talking about it, though.
Yeah,
I mean,
nobody's talking
you go,
about it.
obviously, the plastic surgeon, they just want to make their money and make you feel better, look better. So that's a good question I have for you because, after seeing your post and hearing you and then talking to my niece, it's like, okay, maybe there is something to this, right? Because you're not educated enough. You just want the quick fix, right? How'd you process it after you had them taken out, Jackie?
I was so ready to have them out. Like I could not get them out fast enough, and I've never loved my body more, ever.
I love
I'm not,
that.
I'm not just
I love
saying,
that.
yeah. I'm in the itty bitty club, and I don't care. Like, and my husband.
Some of us
doesn't
have
care.
lived there our whole
That's
lives,
one of the things-
I
yeah,
think women struggle with what you just said.
yeah. A lot of
Yeah.
women. Well, I'll be honest. This is what got me into the implant situation. I'm not blaming a man for it, but I did feel like if I could change my body, I would be more appealing, not to my husband now, but
Right.
to, that I would look better. We as a society have put this image on women that you should look this way to be appealing to men.
Yes.
And, but by the time I decided to have my implants out and the research I had done on it and the things, and just then like feeling convicted and knowing this is what I'm supposed to do, I was so ready to not I hated the way I looked with them. I didn't feel like my clothes were fitting. Everything felt tight to me because I'd also gained weight. So it wasn't just
When you
the
gain
implants.
it looks bigger. Everything looks bigger,
so
right?
Clothes weren't
Yep.
fitting right. I felt so uncomfortable. I felt they were obnoxiously big. I felt like that's what people saw. That's what was the attention that was focused on, and I just hated it. I wanted them gone. I wanted them so bad, and I have a really cool explant story about how it happened. But my husband is like, I think he finds me sexier now than ever.
Aw, I love that.
Yeah,
That's beautiful.
And I feel so good. My clothes fit well, and I just feel so good about it. But I think it's important for women to understand risks and benefits of having it. And I think for so long we've just been thought that there were no risks to it. Like, hey, and even if there was, at least I'm going to die. At least I'm going to die with pretty boobs,
Yes.
And no one cares.
Yeah, but you will care.
Yeah, I know, right?
You will care.
You will care.
You
Yeah,
will care.
but it's like you said, no one cares. They don't think about the long-term effects of having something done. I mean, I didn't.
No, I didn't either.
And
Yeah.
definitely, I hear what we're talking about, and I think it's so important for people to make a very informed decision before doing that. I also want to just bring out the other side of that, and you have women who've had mastectomies and they've had to lose their breast, and how important it is for them to have an option to rebuild and feel good about themselves. So I don't want to totally villainize implants because I think they have a purpose.
Right.
I think you just have to make a really informed decision about what you're getting into when you make that choice. Yeah.
And there are other options too, rather than implants. There's fat transfers and things like
They're
that.
doing some neat things,
and
yeah.
even outside of women who have mastectomy, even just women who want to have implants, do
Yes.
it.
Yeah.
Just know all the risk.
Yes.
And I do think there are a lot of women who are struggling with the rejection of implants or the breast implant illness that don't realize it's related to that, or maybe don't want to. They're like, I love my breast. I don't want to.
Yes.
But they're like, oh, I have implants and I've never had any issues.
That you know of.
But then they do, but then they were just, they have dystonia, or they have these skin issues, or they're suffering with uncontrolled anxiety and all these things that I'm like,
wow.
do you?
Yeah, look at it and see. You may just be trying to talk yourself out of it.
Yes, and I get that. That's the right that everybody has, but I think it is something we should take a long, hard look at and see, are these really affecting me? And I think down the road, we are going to be connecting the dots backwards to a lot of other issues, from mental illness from anxiety, depression, that I do feel like is directly related to the breast implant illness, to major things like cancer and autoimmune disorders and things like that, that we're going to look back one day and be like, how did nobody know that? We look back now on smokers and think, oh, how did you not know that was going to cause lung cancer?
Yeah.
So I feel like we're not there yet, but I think that, it's dismissed in a lot of ways, but I will say that finding a good plastic surgeon is very important. There are lots of amazing surgeons across the country that will remove the implants, that believe in breast implant illness, that will remove them and the whole capsule, because that's important. I know the surgeon that I went to for removal, she had hers removed. Her nurse had hers removed. That meant a lot to me.
Wow.
That spoke a lot to me.
Yeah.
Like, okay, if this plastic surgeon is having hers removed, she probably feels like there's validation to this. Even though in the general plastic surgeon world, I think they are saying, breast implant illness is in your mind, or it's these other things, and it's not attributed to the breast implants, when I think looking back one day, we'll see that more and more of our illness and issues can be related to that. And I just wish that women would understand. I wish if I could have told myself back then, and I wasn't a young girl, I waited till way in life to have implants. It wasn't like I was 18 years old when I got them, but still, I wish I'd have had more confidence in myself at the time and not done it for the reasons that I did.
We think about it, the letter A is so positive. You get A+. You're A-OK. There's nothing wrong with an A cup. I'm just telling you. See what I'm saying? So
I wish I had told myself that.
Yeah, I really do. I wish that I could have I felt if there were a lot of issues in my life going on that had I been seeing a therapist, probably would have worked them out instead of going to see a plastic surgeon. But a lot of things in my life that I felt like, if I looked better, if I was more proportional, I would be more successful in my health and fitness career. My marriage would be better. I ended up getting divorced anyway, even with, So I feel like there are a lot of things that I was trying to correct by changing the way my body looked. Mm-hmm. And I just wish more women were so confident in themselves and with their bodies, myself included, that I didn't feel like I had to do something so drastic.
And I think, unfortunately, social media.
Yeah, we're living to a social standard.
These poor women are under now. Because I was like, I had mine done at 27, so it wasn't like I was really young when I had it done. But, the only reason why I did it was because I worked out all the time, and I was well-proportioned everywhere else, but there I was a negative A almost. Like, it was like nothing. Yeah. But you're right. If I go back now, you and I will be talking after this interview. If I go back now, I think, there's so many things I should have just loved myself more for. Yes. You just got to love yourself and know that you're perfectly made the way you are.
Yes. Your body is made that way for a reason.
And to be healthy and fit and take care of ourselves can go a long way. We don't necessarily have to augment, especially if looking back, if there's a mental part of that, that you really should be healthier in that capacity before you make
a big decision like that,
because then you find yourself, a decade or more down the road regretting and having to do even more invasive things to take care of that.
So in closing, what do you want to tell the audience, Jackie? What do they want? And then tell the audience how they can reach out to you if they want a doula.
Doula, it really just means someone who serves. And I think that I wish that every pregnant woman could have the benefit of a doula. Like my dream would be able to have every mama that walks in the hospital, if she wants to have doula support, to have doula support. I wish every mama that reached out to me could have doula support. Mm-hmm. We really are there just to serve and help this mama have the best pregnancy that she can have. And so for a woman who feels scared going through pregnancy for the first time, or maybe has experienced trauma in her past birth, reach out to a local doula organization or a doula's in your area to find the one that fits with you. And the beautiful thing is we interview, we get to know each other, and you truly want someone in your space that you feel connected to. It's a very intimate time in your life, and you want to feel like the person there is one that you're really connected with. So I always recommend interviewing multiple doulas. Even when I'm interviewing with other women, I say interview other doulas, make sure that I'm the one that you want in your birth space. And there's someone there for you. You can find a doula that will serve you and serve you well in your space.
I love it.
Absolutely. And takeaway from here is love yourself enough to make good decisions for yourself. Love yourself enough to do things that are maybe out of the ordinary. So we really want women to be confident, to love themselves, to know that you have more power and control than you think you do. Yeah. So there's so many things and decisions that we as women have to make in our lives. And we just want to know that we can make them with the confidence and the support. And that's what we're here for. We just want to make sure that women feel loved, supported, heard, and validated.
Reach out 100%. For help. Yeah. Reach out for people.
And we'll put a link in there too for anybody that wants to reach out to Jackie or need further information about,
finding a doula.
Having
absolutely.
a doula or hormones.
Or hormones, any of that.
Any
or if you have questions about breast augmentation.
Open book.
100%.
Awesome, so.
Well, we always want to leave with a this or that. Absolutely. Since we're 3 Texas women, I'm going to go Tex-Mex or authentic Mex when it comes to food.
Oh, I'm Tex-Mex.
100%. I got to agree. I feel like it's kind of just balanced out with a couple of other flavors and influences in there. I love Tex-Mex.
I'm opposed to trying different things. I love different things, but on the norm, I'm going to this or that. I'm going with Tex-Mex.
Tex-Mex. What about you, Brandy?
I'm authentic.
You're authentic?
Yeah.
You use ketchup on Mexican food. You're not authentic.
Both of y'all are fired, okay? But no, authentic Mexican food?
Yes.
I mean, you can't.
It's got some value to it.
You can't fight with the lard and the beans. I'm just saying.
I think you have to train your palate, though. I mean, I've grown up on Tex-Mex. Yeah. Then you throw it into
authentic, and you're like, that's not Mexican.
It's like, what is this? What is this? Yeah, there's some spices in it that are a little different than you'd get at Tex-Mex.
Yeah, I'm a little ashamed to say that, but it's the truth. If I ate a little more authentic, I might like it more.
Oh, we love it. Well, thank you, Jackie. You have been so wonderful, and we're so glad to have you on here.
We'll have to get you on the show again.
Absolutely.
Thank you so much.
If you or anyone you know is struggling with mental health issues, please reach out to talk to someone you trust. Get connected to a mental health professional who can help you find ways to cope and ultimately feel better. If you are having suicidal or self-harm thoughts or thoughts of hurting another person, please go to the nearest ER, call 911, or contact the National Suicide Hotline at 988. Thank you for tuning in to Mental Perk. We hope our talk today highlighted real people working through real issues based on mental health. Our goal at Mental Perk is to make sure every one of you knows you're worthy. We're in this together.